Okay, well, we've got probably about 13 minutes left. We've got a lot to talk about. We're just going to do the best that we can here, covering, like I said, a few highlights. Um, so, in the past, again, we talked about this pre-existing condition thing and your health history. So, how do health conditions affect your rating, premiums, and the ability to get health insurance?
Basically, the rating of a medical insurance policy starts from a base assessment of what they figure the claims might be relative to the person's state of health.
Mm-hmm.
So if the insurance company looks at their whole book of business and they say, okay, we know that we are going to spend $5,000 a year in care for the average person, then if someone has a condition that they know is going to cost them more than the average, then they're going to want to charge up for that. Mm-hmm. Now, this is very simplified of mm-hmm. their whole process, and of course they have actuarial experts and computer programs that do this stuff. But so basically anything that takes you as an individual person out of the average group, then they would want to rate more for that. So today it's interesting in that there is more access to individual insurance now. It used to be very hard to get anybody insured that took any kind of medicine at all, and now it's loosened up to where they are willing to rate up policies, 20% or 25% for certain conditions. These are all dependent upon underwriting, which mm-hmm. is, we send the information to the insurance company. They take a look based on their tables and their thing, and then they come back and say, okay, we're able to insure you for 110% of what a normal average person would be.
But is it pretty standard now to get a medical examination if you're applying for individual medical insurance?
No, not an exam.
No.
They would do the underwriting based on the application that you fill out, which, as you know, is lengthy in many cases. And then if they see something in the application, then they have a right to go to your physician and get the physician's records, which they do frequently for things that they're worried about.
Makes sense.
Mm-hmm.
Okay. So what about how healthcare is affecting all this eventually, if things go according to schedule?
Well, you mean if the Democrats prevail?
Well, whatever. Okay.
Yeah. Well, what will happen in 2014, which is the date that it kicks in fully for most of the provisions, and in 2014 there will be insurance exchanges created, which will then provide or allow individuals or small or large businesses to purchase coverage through that exchange. And there'll be standard benefit designs based on 4 standards. So bronze, silver, gold, and platinum. Okay. And these are based on the percentage of the medical costs that they are designed to address. Mm-hmm. So 90, 80, 70, 60 percent on those costs. So those will take effect again, so long as everything goes through. And then employers will need to decide whether they will in fact offer insurance or not offer insurance and have their employees go to the exchange. The key to it is nobody's locked anymore relative to insurance. Now individuals can get the same insurance that group insurance can have, and there's going to be no pre-existing condition, no rate up, nothing like that. So everybody's going to be at the same. Now,
so is this going to be sort of like a website that you go to? You think where you're going to, here's, like 5 or 6 plans that are comparable, and so you can look at the cost, and maybe they'll have some sort of information about what people are saying about their experience with the plans? Or
Yeah, exactly. And they do have these websites are up already
okay,
for people to look at. I'm assuming that ultimately they will end up looking like Medicare's website. And let me hurry up to tell you, because I am an insurance agent, and that is how I make a living, is by helping people to understand these things and decide. They're like Medicare. There probably will be adequate information. The problem is being able to sift through that information effectively and make a decision that's best for you, which therein lies the place for the person like myself and my associates. I don't suspect that most people will be able to navigate this on their own and maybe come up with a decision, because there will be definite different issues that they'll want to take into consideration.
okay,
But they do. It is going to be website driven.
okay. And so, are all the states going along with this?
Well, right now we have 20 states that are charging ahead, I would say, relative to exchanges, California being one of them.
Okay.
And then there are 30 states that are kind of holding back. And as you know, 26 states have filed this lawsuit that is going to be addressed at the end of March. So decision they feel, the experts feel, will be about June. So I suspect that people are the 30 that are hanging back are probably waiting to see what's going to happen rather than just go ahead. It appears that the 20 feel that it's a good idea. Now, the other thing is that maybe some of those 30 states don't intend to have their own exchange anyway. Maybe they're going to just let the government do an exchange for them, which is the other option that they have. So that's a possibility as well.
So I'll just throw this out, because as we were talking about these different states, and in fact, 30 sounds like, well, the majority aren't participating, but are Texas, California, and New York, are they all on board?
New York and California are on board. I'm not sure about Texas.
That's kind of a rebel state.
Yeah.
But those are like the three major ones that come to my mind as far as population.
But I know California was the first state to file and get the money and start to develop the exchange. So we're down the road. But of course, remember that we've had an exchange here in California in the past. We had the PAC Advantage program, which was run a few years ago, and basically couldn't. For whatever the reasons are, couldn't make it work. But that was the original exchange.
Maybe sort of the model for what they were talking about. What's the individual mandate, and why is it being challenged?
Well, the individual mandate says that effective January 1, 2014, every citizen of the United States will be required to have health insurance, to buy health insurance from somebody. And now, so the rub here is that there are people who say that the Congress doesn't have the right to require people to buy anything. Now, and that's what's going to be decided in March. So that'll all be clear as to whether that's going to work or not. The interesting implication of it is this: what makes the healthcare and the exchanges work right is that people are able to get insurance without pre-existing condition exclusions, which is what's been the problem with our individual market over the years. So without the mandate, I'm worried that the insurance companies, the rates that insurance companies will pay, will have to be extraordinarily high in order to take into consideration the adverse selection, which is where only people that need insurance buy it. The young, healthy people who don't need it, they don't buy it because they know they can get in at any time. So I think all of those things are kind of intertwined in whether that whole the exchange, the guaranteed issue, and the individual mandate will work together. So it'll be interesting to see how that comes out.
Okay. So we just have a few minutes left. I want to try to hit a couple of the major areas for people to understand related to individual medical insurance.
Okay.
So what are the principal types of medical insurance?
Well, you basically have three general arrangements. One is an HMO plan, Health Maintenance Organization, which is basically, in its original design, was to keep you healthy, have low cost when you actually go to the provider, and in the HMO plans today, the providers are financially involved in the person's care. So if they keep a person healthy, they actually end up making more money, and therein lies, one of the greatest problems that we've experienced with HMOs, and that is that people are hard pressed to get a referral to a specialist because there's financial incentive for the individual doctor. So these are you have Kaiser, which is the most successful, I think, model, a staff model HMO, which operates, and then you have all the other programs that have HMO. But basically the idea here is copays, low copays, and no deductibles, high coverage. The other type would be a PPO plan, and that is a form of managed care as well that has a list of doctors.
So that's the
preferred provider organization,
okay.
Right? So you would, if you go to the list of doctors, then you would get a discount. There's no financial incentive there. It's a strictly fee for service, which would be defined as when the person goes, that's when the service is provided. Whereas the HMO, there's a set fee that's paid every month to the participating. Some derivatives off of the PPO and HMO plan these days are HSA, health savings account plans, or actually they're high deductible health plans that are connected with a health savings account, which is the latest thing that the Bush administration brought in, which I think is a really good idea. And it's designed to get the participants back into the buying decision. So we want people to call three different hospitals and find out how much that MRI is at each place, and then reward the low cost producer.
But the savings that people were hoping for don't seem to be materializing for these HSAs. We've seen some pretty big premium increases.
Yeah, the premium increases have been huge, and the claim is that the experience has not been good. And so that's probably true. I'm not exactly sure of that because I'm not an actuary. So
okay.
So yeah, that's
all right. Well, we've hit some highlights. Maybe you could just throw out a final thought, but we only have maybe 30 seconds left. So,
well, I think if there can be anything exciting about healthcare, this next year will probably be it because of the major events that are going to occur with the Supreme Court and with the presidential election. We will also have some evidence about one of the main provisions of the plan was these accountable care organizations, which have come into play beginning January 1st, which are designed to reduce the cost of care. And if those are successful, that would be just another piece of the whole thing. So it's going to be interesting.
Don, thank you for joining me.
Thank you.
Folks, we hope we've given you something to think about, a little bit of information about what's the developments that are happening anyway in the individual health insurance area. And we hope you can join us next time on Financial Insider Weekly.